talk a little bit about yourself as an OB doctor, like how many years of experience, and then those ABOG, ACOG recognition.
Okay. Yeah. All right. My name is Dr. Jennifer Broad. I've been trained as a medical doctor for 14 years. I was trained in my residency in obstetrics and gynecology as a specialist for about 10 years. Beyond that, I stayed where I trained at Loma Linda University Medical Center and stayed on as a teaching professor, attending doctor, where I trained the residents and the medical students coming up in medicine and obstetrics and gynecology. Loma Linda is a world-renowned teaching hospital, and it takes care of the highest risk patients. So I've cared for normal, healthy moms, but I've also taken care of moms with gestational diabetes, advanced maternal age, which is older than 35 years old, complicated pregnancies involving preeclampsia, HELLP syndrome, also multiple gestation, so twin and triplet, quadruplet pregnancies, preterm labor, short cervix, multiple C-sections, thin patients, obese patients, the spectrum. And they've usually come from the community. Doctors from, the outside private doctors would send their high-risk patients to myself and my colleagues to care for. So lots of years of experience, and now in private practice. So now giving my personal care and taking more time with patients on an individual basis.
Good. Yeah, good. So how do you feel as a female doctor, and then how do you take care of patients? And also, what is your strength as a female doctor?
Okay. So as a female doctor, I think it comes with a lot more care, understanding, empathy, sensitivity. I myself has gone through many of the same experiences as my patients. I have 4 children, so I've been through pregnancies. I've had complications in pregnancies. I've had to have bed rest and growth restriction and kind of problems that took more time and care and more visits with the doctor. I've had vaginal deliveries. I've experienced epidurals. I also had experience with infertility and in vitro fertilization, so IVF. So I've kind of been through the spectrum. I think that helps with understanding what the patients are going through. I also am a wife, so being a wife, a mother, and running a business, I have kind of a complex way of handling and multitasking. So I think I have a lot of experience personally and professionally to kind of understand and help the patients go through their experiences. And also breastfeeding and aftercare, all that stuff is important, and especially first-time moms and don't know what to expect, I can kind of help them feel more comfortable in the process. And then again, I'm an experienced surgeon, so when I need to deal with something, my office is 2 minutes from the hospital. I live down the road, so it takes me less than 6 minutes to get to the hospital. So very close proximity. I take my patient care very seriously, and again, I've been there, and I can make people feel more comfortable as they go through their own experiences.
Good. Could you also talk about the differences between the Chinese patient who came here for their 3rd trimester compared to the local patients?
Okay. I understand from the Chinese patients, they're coming from far away, so they're getting familiar with a doctor far away, so that's a different way to start a pregnancy. And then to come here, there's a lot of unknowns, maybe expectations, and coming to a new place they've never been to. Maybe they don't speak the language. It can feel scary and unfamiliar. But in this process, we've worked very closely with our Chinese interpreters. You guys are very hands-on with the patients, available 24 hours. You can help them to feel more comfortable when they're not directly with the doctors, and then we work directly with you. You understand the culture here. You've had experience with us doctors here. You know how things work at the hospital. So between your personal touch and our relationship, we try to help the patients feel more comfortable in a kind of scary transition. What else? I've also lived abroad myself. I lived in Japan twice for a couple months at a time. So I know what it's like to go into an unfamiliar place. But it is nice to feel like someone understands, and it also makes you feel comfortable and well cared for as you're going through your experience.
Chinese patients are worried about they cannot communicate well with you, so you can tell them, in the answer, you can tell them we have professional translators, and then we'll help translate in the office, translate their medical records, Chinese medical records they bring from China, and also talk about some of the video translation in the hospital to help.
Okay. I know some of the current concern is a communication barrier. So again, we work really closely with our Chinese translators. They're a part of the kind of warm welcome from the time they come here. They have constant contact with you guys, the translators, who also, again, work closely with us, and we're able to communicate on a constant daily basis if need be, again, to make them feel more comfortable. Here, the translators help to bring the records in. They're helped to translate the records for us, so we understand exactly what's going on in their care while in China, and also continue the good care that they have here. And we also have 24-hour interpreter service at the hospital, at Hoag Hospital. So there's good communication between the nursing staff and the other staff that help to care for the patients. And just a lot of making the patient feel comfortable. Even when they're outside of the office, we're always able to communicate with our translators. You're present here in the office, so there's never a time we don't know what's going on with your care.
Next question is about VBAC. So in China, their C-section rate is about 50%.
Wow, okay.
Yeah, and then but nowadays more and more people realize there's lots of benefits for trying vaginal delivery. So lots of people are considering about having VBAC, try to have a vaginal delivery this time.
Okay.
Yeah. So could you talk about a little bit about the VBAC and then your experience and the hospital experience to ensure the safety, and then try to help them as much as possible?
Okay, so we call it the trial of labor after cesarean section, or a TOLAC. A VBAC is when you successfully have a vaginal delivery after a previous C-section. So we do VBACs here. They're very safe, up to 80% success rate here. The complications that can happen is most not common. It's less than 1%, the uterine rupture. We're constantly monitoring the baby. Even when the doctor's not present in the hospital, we have electronic digital access to the patient record. We're constantly watching baby and mom. We're in communication with the nurses. So if ever there's a concern for any complications, we have direct access to the operating room if we need to do an emergency C-section. The greatest success for having a vaginal delivery after C-section is if the previous C-section was for breech or non-recurring situations. Sometimes other doctors in other locations do elective C-sections because they don't explain to the patient that it is healthier for mom and baby to have a vaginal delivery. But the C-sections are there if need be here. But if you have multiple C-sections or you want more than one child, having a vaginal delivery is safer. Again, baby takes the first breath coming through the vaginal canal. That's good for baby. Decreases blood loss, risk of infection, and also the complications that can happen with multiple C-sections. There's a lot more scarring, and there's complications potentially damaging structures during multiple C-sections. So again, the benefits of having a vaginal delivery is great. Also, again, there's risk of the placenta not implanting where it should be, so there's increased risk, again, with multiple C-sections. So having an opportunity of a vaginal delivery is much safer for mom and baby. And if there is a need for an emergency C-section, everyone's there in the hospital and in close communication to make it happen fast and safely for mom and the baby.
Great. It's very smooth for those videos, okay? Lots of patients are wondering how to make the C-section scar beautiful. And then no matter how long is the scar and how low it is. And then can they wear a bikini after the C-section? What if they have a keloid from their previous C-section? How would you take care of that?
Okay, I know being beautiful is very important for all women. So with the cesarean section, the scar is usually to accommodate the baby's head and shoulders. So it's about 12 to 14 centimeters. It's really right above the pubic bone. So it's cosmetically appealing. It's below the underwear and the bikini line, so you can not show it to other people. In order to beautify things, there's options to use steroid injections and scar cream that can help with healing and prevention of keloid formation. So there is lots of options to have a C-section and still keep your beautiful figure.
About those patients who are more than 35 years old.
Yeah.
I want to know what is the oldest patient that you've ever delivered and what's your experience with taking care of those older patients? Do you notice any difference and anything you need to be aware of? And then,
Okay. So as women have had their careers, they sometimes put off childbearing and so the age of new moms has gone up. And at Loma Linda, I've had even a 50-year-old mother, didn't use her own eggs. It was in vitro with donor eggs. And there are increased risks with advanced maternal age. The higher in age, the more risks there are. We're considered advanced maternal age after 35 years old. But like I said, with increasing age, beyond 40, we also take precautions, knowing that there's increased risk. There's increased risk for an operative delivery, for C-section, for labor not to progress as easily. There's also risk of preeclampsia and other heart-related things, but we're aware of these risks. Later in pregnancy, we have fetal monitoring we do twice weekly. So just to make sure that the baby is doing well and mom's doing well. We monitor for preeclampsia throughout the pregnancy. And there's increased risk for Down syndrome and other sort of syndromes. But again, with genetic screening, we usually find out these things ahead of time. So overall, again, we're aware of the risks. So we monitor for signs of any conditions as the pregnancy is progressing. And we do monitoring more closely for moms over the age of 38 with the fetal monitoring. So we're able to take care of and protect and bring healthy moms and babies, through the process safely. And so all of that is manageable. Healthy mom, healthy baby is the goal, even when we're over 35, like myself.
And now we come to the last question.
Okay.
As we'll tell you some of the Chinese words.
Okay.
Yeah. So very simple ones.
Okay.
Start with first, hello. How to say hello in Chinese? 你好.
你好.
Yes. Good. 欢迎你.
欢迎你.
Good. Yeah. 我是.
我是.
Good. 珍妮.
Jenny.
Yeah. Good. 医生 means doctor.
医生.
欢迎.
欢迎.
中国.
中国.
妈妈.
妈妈.
Yeah.
你好。我是 Jenny 医生，欢迎中国妈妈。I'm looking forward to caring for you Chinese mothers. Welcome you to my office. Our staff is looking forward to taking care of you. Welcome to Hoag Hospital. Welcome to Newport Beach, California. You're going to enjoy your stay and you're going to be well cared for. I look forward to meeting you.